NHA CCMA practice test walkthrough. Question 1. When coordinating care for an older adult patient who is transitioning from an acute hospital stay to a skilled nursing facility, what is the primary goal? Option A. To increase out-of-pocket costs for the patient. Option B. To ensure continuity of care and safe execution of orders. Option C. To limit the number of medications the patient takes. Option D. To prevent the family from visiting the patient's room. The correct answer is option B. To ensure continuity of care and safe execution of orders. Care transitions require meticulous communication of active diagnoses, medication lists, and treatment orders to the receiving facility to prevent gaps in care, medication errors, and readmissions. Continuity of care is the central goal of all transitional care planning. Question 2. A patient has insurance coverage through a primary policy and a secondary policy. To determine which policy is billed first for a child covered under both parents' plans, which rule is applied? Option A. The birthday rule. Option B. The coordination rule. Option C. The priority mandate. Option D. The age seniority rule. The correct answer is option A. The birthday rule. The birthday rule states that the insurance plan of the parent whose birthday falls earliest in the calendar year, month and day, regardless of year, is the primary insurer for dependent children covered under both parents' policies. Question 3. Which insurance model requires patients to choose a primary care provider, PCP, and obtain referrals to see specialists? Option A. Preferred Provider Organization, PPO. Option B. Health Maintenance Organization, HMO. Option C. Workers' Compensation. Option D. Indemnity Plan. The correct answer is option B. Health Maintenance Organization, HMO. HMOs require members to select a PCP who coordinates all care and issues referrals to in-network specialists. PPOs allow direct access to specialists without referrals, offering more flexibility at higher cost. Question 4. What is the fundamental functional unit of the nervous system responsible for transmitting electrical impulses? Option A. Nephron. Option B. Alveolus. Option C. Neuron. Option D. Osteon. The correct answer is option C. Neuron. The neuron is the structural and functional unit of the nervous system, transmitting electrochemical signals throughout the body. The nephron is the functional unit of the kidney, and the alveolus is the gas exchange unit of the lung. Question 5. In a normal cardiac conduction cycle, which structure acts as the primary pacemaker of the heart? Option A. Atrioventricular, AV, node. Option B. Bundle of His. Option C. Sinoatrial, SA, node. Option D. Purkinje fibers. The correct answer is option C. Sinoatrial, SA, node. The SA node, located in the right atrium, is the heart's primary pacemaker, generating impulses at 60 to 100 beats per minute under normal conditions. If the SA node fails, the AV node assumes pacing at 40 to 60 bpm. Purkinje fibers can pace at 20 to 40 bpm as a last resort. Question 6. Which of the following fasting blood glucose results falls within an abnormal, pre-diabetic range for a non-diabetic adult patient? Option A. 65 mg/dl. Option B. 85 mg/dl. Option C. 115 mg/dl. Option D. 145 mg/dl. The correct answer is option C. 115 mg/dl. ADA criteria define prediabetes, impaired fasting glucose, as a fasting blood glucose of 100 to 125 mg/dl. Normal fasting glucose is below 100 mg/dl. a result of 126 mg/dl or higher on 2 separate occasions meets the diagnostic threshold for diabetes mellitus. Question 7. A medical assistant is participating in a patient-centered medical home, PCMH, model of care. What is a core concept of this healthcare delivery design? Option A, fragmented specialty care focused on acute injuries. Option B, comprehensive, team-based care centered around the patient. Option C, minimizing communication between providers to reduce cost. Option D, prioritizing diagnostic testing over preventative wellness. The correct answer is option B. Comprehensive, team-based care centered around the patient. The PCMH model emphasizes comprehensive, coordinated, team-based primary care that is patient-centered and focused on continuity. It integrates preventive care, chronic disease management, and care coordination across all settings to improve outcomes and reduce fragmentation. Question 8. Which of the following topical wound treatments is commonly used to debride non-viable tissue from a partial thickness burn? Option A, hydrocortisone cream. Option B, silver sulfadiazine. Option C, isopropyl alcohol. Option D, hydrogen peroxide solution. The correct answer is option B. Silver sulfadiazine. Silver sulfadiazine is an antimicrobial cream widely used on partial and full thickness burns to prevent infection and assist in wound debridement. Isopropyl alcohol is cytotoxic to healing tissue and should not be used on open wounds. Question 9. While running an EKG, the medical assistant notices a jagged, erratic baseline artifact across all leads caused by patient shivering or tension. Which artifact is this? Option A, wandering baseline. Option B, somatic tremor. Option C, alternating current, AC, interference. Option D, interrupted baseline. The correct answer is option B. Somatic tremor. Somatic tremor artifact appears as a jagged, irregular baseline caused by voluntary or involuntary muscle movement, such as shivering, anxiety, or Parkinson's tremor. AC interference produces a uniform 60 cycle per second pattern, while wandering baseline is caused by poor electrode contact or patient breathing. Question 10. What type of healthcare setting specializes in providing care for patients who have a terminal illness and a life expectancy of 6 months or less? Option A, ambulatory care center. Option B, long-term care facility. Option C, hospice care. Option D, acute care hospital. The correct answer is option C. Hospice care. Hospice care focuses on comfort and quality of life for terminally ill patients expected to live 6 months or less. It emphasizes palliative rather than curative treatment. Long-term care facilities provide extended nursing care but are not specific to end-of-life patients. Question 11. When coding an office visit encounter, which code set is used to report a provider's diagnostic evaluation and clinical decisions? Option A, CPT codes. Option B, ICD-10-CM codes. Option C, HCPCS Level 2 codes. Option D, modifier codes. The correct answer is option B. ICD-10-CM codes. ICD-10-CM, International Classification of Diseases, 10th revision, clinical modification, codes are used to report diagnoses, conditions, signs, and symptoms. CPT codes describe the services and procedures performed. Both code sets must be included on a complete claim. Question 12. A medical assistant performs a clinical task that is strictly outside their legal scope of practice, resulting in harm to a patient. This is an example of which legal concept? Option A, nonfeasance. Option B, malfeasance. Option C, contributory negligence. Option D, slander. The correct answer is option B. Malfeasance. Malfeasance refers to performing an act that is unlawful or wrongful, such as practicing outside one's legal scope of practice. Nonfeasance is failure to act when there is a duty to do so, while misfeasance is the improper performance of a legal act. Question 13. A medical assistant is documenting a laceration located on the anterior distal aspect of the forearm. Where is this injury located? Option A. On the front of the arm, near the wrist. Option B. On the back of the arm, near the elbow. Option C. On the side of the arm, near the armpit. Option D. On the front of the arm, near the shoulder. The correct answer is option A. On the front of the arm, near the wrist. Anterior means the front surface, and distal means farther from the point of attachment, toward the wrist. Together, anterior distal forearm refers to the front of the arm near the wrist. Proximal would indicate closer to the elbow. Question 14. Under the patient's Bill of Rights, patients have a legal right to which of the following? Option A. Free medical care regardless of insurance status. Option B. Access to and a copy of their own medical records. Option C. Guarantees that every treatment will cure their illness. Option D. Choice of any specialist without an insurance copay. The correct answer is option B. Access to and a copy of their own medical records. Under HIPAA and the Patient's Bill of Rights, patients have the right to inspect, review, and receive copies of their own medical records. No law guarantees free care, treatment outcomes, or unrestricted specialist access without insurance network considerations. Question 15. A patient is non-compliant with their hypertensive medication because they do not understand why they must take a pill when they feel fine. What action should the medical assistant take? Option A. Inform the patient that they will be dismissed from the practice. Option B. Provide educational materials explaining asymptomatic hypertension. Option C. Tell the patient to double the dose when they feel stressed. Option D. Document the non-compliance and ignore the issue. The correct answer is option B. Provide educational materials explaining asymptomatic hypertension. Hypertension is often asymptomatic until it causes end organ damage, so patient education explaining this concept is essential for compliance. The medical assistant should provide appropriate materials and notify the provider. Dismissing or ignoring non-compliance is clinically and ethically inappropriate. Question 16. According to developmental psychology stages, a child who is experiencing a conflict between industry versus inferiority is typically within which age range? Option A. 1 to 3 years old. Option B. 3 to 6 years old. Option C. 6 to 12 years old. Option D. 12 to 18 years old. The correct answer is option C. 6 to 12 years old. Erickson's stage of industry versus inferiority occurs during middle childhood, ages 6 to 12. Children in this stage are learning to master academic and social skills. Failure to develop competence leads to feelings of inferiority. Question 17. A medical assistant is cleaning up a small blood spill on a laboratory counter. Which disinfectant solution is recommended by OSHA? Option A. 70% isopropyl alcohol. Option B. 110 dilution of sodium hypochlorite, household bleach. Option C. chlorhexidine gluconate. Option D. hydrogen peroxide 3%. The correct answer is option B. 110 dilution of sodium hypochlorite, household bleach. OSHA recommends a 110 dilution of sodium hypochlorite, bleach, as the standard disinfectant for blood spills because it is effective against blood-borne pathogens including HIV and hepatitis B. Isopropyl alcohol evaporates quickly and may not maintain contact long enough for full disinfection. Question 18. A medical assistant is performing ear irrigation to remove impacted cerumen. Where should the stream of warm solution be directed? Option A. Directly at the center of the tympanic membrane. Option B. Toward the top or side of the ear canal wall. Option C. Toward the floor of the external auditory meatus. Option D. At the opening of the eustachian tube. The correct answer is option B. Toward toward the top or side of the ear canal wall. The solution should be directed toward the upper or posterior wall of the ear canal, not directly at the tympanic membrane, to allow it to flow behind the cerumen and flush it outward. Direct pressure on the tympanic membrane can cause pain or perforation. Question 19. A medical assistant is preparing a patient for a pelvic examination and Papanicolaou, PAP, smear. Which position is most appropriate? Option A, dorsal recumbent. Option B, lithotomy. Option C, Fowler's. Option D, jackknife. The correct answer is option B, lithotomy. The lithotomy position, with the patient supine and feet in stirrups with hips and knees flexed, provides optimal access for pelvic examination and pap smear collection. Dorsal recumbent is similar but without stirrups, used for abdominal exams. Question 20. According to current American Heart Association guidelines, which of the following blood pressure readings is classified as elevated? Option A, 118/76 mmHg. Option B, 124/78 mmHg. Option C, 132/84 mmHg. Option D, 142/92 mmHg. The correct answer is option B, 124/78 mmHg. AHA guidelines define elevated blood pressure as a systolic of 120 to 129 mm Hg with a diastolic less than 80 mm Hg. Normal is below 120/80. Stage 1 hypertension begins at 130/80, making 132/84 stage 1.